All right, Bree, thanks so much for doing this. My first question that I have for you is, just tell the audience a little bit about yourself and how you started in the mental health space.
Sure. Yeah, so I am a licensed clinical social worker and I have my own private practice therapy service. I kind of came to this world rather naturally. I think a lot of therapists find that, where I always was really inclined to having good relationships with people. People really like to tell me about their problems, whether I like it or not. But I actually found that I really do enjoy it. I like the human connection. I like helping people. And so in college, in my undergrad program, I had some really great professors that were therapists and introduced me to the field of social work. And so once I made a commitment to that in my education, it became a very clear career path that I wanted to be a part of. Um, I started off in a lot of community health clinics and public schools. And um, just these past 2 years, I've started doing private practice therapy, mostly with adults.
Mm-hmm. And who was your mentor that you sort of looked up to and said, I want to be a social worker?
Uh, Definitely one of my professors. She went by her first name, Louisa, so I can't even remember her last name right now. But just hearing some of the conversations she got to have with her therapy clients, being with them through some of life's biggest challenges and changes, like losses in family or having a child or marriage. I mean, I just hearing the depth of life that she got to experience through being a therapist, like really appealed to me. And she always brought a lot of her personality to her class, and I like that I can bring a lot of my personality to my work too.
Mm-hmm. So what do you do now in your private practice? What sorts of things do you focus on or specialize in?
Yeah, so a lot of my therapy clients identify as LGBTQ. I myself identify as a bisexual queer woman. Um, and so helping queer people through changes in identity or some of the mental health struggles that can come along with being queer. That's a big part of my practice. I also offer ketamine assisted psychotherapy. So I've had an interest in psychedelics for a lot of my life. And more recently, it's becoming widely accepted in the Western medical world. Um, and traditionally, throughout the world, psychedelics have been a tool for healing. So, offering ketamine as a medicine that I work with has been really successful in my practice, especially for treating people um, with PTSD, depression, anxiety, um, especially if other medications haven't been working for them. This is a great option, and I've seen it help a lot of people.
Mm-hmm. What do the therapy sessions look like when you have clients come in and they sort of talk about their struggles with um, identity or like being able to fit in, their sense of the world? How do you sort of help those people, who are struggling with that?
Mm. Well, we talk a lot about what it means to be authentic and getting in touch with their true self. Um, Sometimes when we feel anxious or depressed, it's because we're trying to fit into the rest of the world or other people's expectations about what we should want or what we should be. And so, especially working with queer people, it's like accepting and celebrating who they are, and yeah, that's their greatest gift in this world is being authentic. Um, but it can be hard to navigate, like how to interact with family or work or friends that might not have the same values as them.
Mm-hmm. Because the reason why I bring that up is because I remember talking to this counselor in London, England, and she specializes on sort of transgender folks and sort of, and I remember asking her why because I'm curious, because I was curious, why is it that folks sort of transition from males to females or vice versa? And she said a lot of the times it's because the body that they were born in, at birth, they don't feel comfortable. Like they don't fit with what they're looking for. So that's why they do what they do. So that I found fascinating.
Hmm. Yeah. Yeah, I have like a strong point of view of believing people, like when they tell you something about themselves. So, I feel like I was born in the right body, assigned female at birth, and I identify as a woman. But if someone is telling you, like, this does not feel true to me, this is not right, like everything in my body is screaming that this is wrong, like, I just choose to believe them?
Mm-hmm. Because I remember I learned this in college, the difference between sex and gender. Sex is what is, it's biologically constructed. So you were born a male. Gender is how you perform in front of others, the clothes that you wear, the personality that you sort of emulate towards others. So yeah.
Hmm. Yeah, and I think the queer community is facing a lot of threat right now here in America. And I think a lot of it is people not learning. So, like, I love that you've learned the difference between sex and gender. I think that could be more widely taught.
hmm My next question is, I know that you mentioned that you used ketamine assisted therapy, but do you use other modalities with folks that you work with?
Hmm. Yeah, some other modalities I'm really drawn to are I love using mindfulness and different somatic techniques. So, mindfulness is being focused and paying attention to the present moment. I think being mindful is a skill to learn. And so, a lot of my therapy is practicing that with people and helping them apply mindfulness to their daily life. Um, a lot of anxiety and depression is either thinking too much about the future or the past or getting stuck in some thought loops. And mindfulness is a great way to let the thoughts pass on by and not be as attached to them. And same with different somatic techniques in therapy. So, soma refers to the body, um, and the body and the mind are always communicating. I mean, the reason we might feel sad is because we get this like wave of energy moving. Maybe we feel sad. Maybe it starts in our heart, like a pang in our heart, and then it turns into tears or like a frown. And so in my therapy, we'll practice a lot of, I call it neck down. So, like going into the body, seeing if we could get in touch with what feels open or closed or tense or tight, and just kind of sensing into what our body's holding on to and what kind of stories or narratives are tied to those feelings.
hmm Is it just a lot of breath work, or what's involved in that process?
Yeah, yeah, you're right on point with the breath work. Um, so a typical therapy session is about 50 minutes long, and I spend a good 10 to 15 minutes always with clients um, practicing some sort of somatic or self-soothing tool. A lot of times it can be breath work, maybe I'll guide them in different breathing techniques. It could also look like just closing down our eyes and starting to tune in and sense into the body. Um, Maybe we might stretch or shake or see if the body wants to move in any way. Um, yeah, and as I'm talking about this, I'm realizing that I do work with a lot of able-bodied people, and I'd be so curious to see like how this intersects with maybe people that don't have as much mobility.
I mean, I'm doing it. I'm doing it now. So, yeah. So, yeah, it's pretty cool. My next question is, what have you sort of learned in doing this kind of work? Is there anything that you take away from doing the work that you do?
Hmm. I mean, I have noticed that this stuff isn't taught at a young age. Typically, when people talk about mental health, they're focused a lot on what they're thinking, and people are leaving out this whole part of the body. And it really can be taught. Like the same way you check in with yourself of like, oh my gosh, like, do I have to use the bathroom? You kind of send your brain down to your bladder area to check on that. You can do a similar thing with emotions. You could say, okay, what's going on in my heart today? Or what's going on in my body today? And just kind of noticing different parts. So I've learned that that stuff is not taught. Um, hmm. I think I've also learned a lot about uh, might be a little out of left field, but like inner child stuff. Like
Mm-hmm.
even in our grown adult bodies, like we are children at heart. Like we have these basic needs of like wanting connection, wanting to love and be loved, and basic needs of safety, like knowing that we have stability, that we're going to be safe and taken care of. So that's something else that stands out to me.
Mm-hmm. It's great that you point mentioned that out because I remember in college, it was senior of high school, excuse me. We had to it was in our English class, and we had to write, letters to our future selves so that by the time we graduated, we could sort of look back and reflect on, oh, we did accomplish this during senior. We did accomplish it during my 4 years of high school. Yeah. So I could relate to that.
Mm-hmm.
Um,
Yeah.
my next question is what's on your bucket list in terms of like learning something new in the mental health space? Is there anything that you think, oh, I'm really curious to really add this or learn more about during my practice?
Yeah. Oh my gosh. Well, I love learning. And so I have a long list of certifications I would want and programs I would go into. But the two that really stand out to me, one is EMDR. And maybe have you talked to some other counselors or therapists with that?
Yes, it's eye movement desensitization reprocessing. Yeah.
Thank you, because sometimes I don't get the acronym right. Um, yeah, and it seems like a really powerful way to treat trauma, to kind of rewire thought patterns. Um, so again, it's going just beyond like talk therapy. It's like, okay, how can we stimulate the body and the brain to create change? And then the other one is internal family systems, or IFS, which is another really popular therapy modality right now. It's the idea that we have all these sub personalities and different parts of ourselves that are trying to protect us and help us in different ways. And all parts are just doing their best. So I think it's a very compassionate and kind of spiritual approach that I would like to learn more about.
Mm, uh, okay. So my last question is for those who are wanting to learn more about getting into the mental health space and sort of learning more about how to deal folks with queer identities or like how to sort of work with them, like what tips, advice would you give? Like like what can you learn from your experience to sort of help folks say, hey, here's how I here's how I would recommend doing it. Here's some tips that could be helpful for you.
Hmm. So for someone wanting to work in mental health and more specifically with the queer population,
Yes.
hmm hmm. I think going into like public spaces, like how I said, my foundations of my career were really in, you know, free mental health clinics or a pediatrician's office and public schools. Because if you're working with the general population, you're gonna meet all different kinds of people, people with different gender expressions, different relationship structures, different family structures. And so maybe it's getting out of your bubble and going, it could be volunteering, it could be getting a job or an internship, but going into these more public spaces where, um, you know, it's accessible to all kinds of people, not just people with the money or with a certain identity. It's a huge blend of the population.
Hmm. And I think, and how important is it to sort of create a community, like a tribe of people that you can sort of lean a shoulder on and depend on?
Oh, that's huge. That's huge in any aspect of life, but I think especially in mental health, you're dealing with people in relationship, like the therapy and client relationship is really important, but then the therapist also needs other people to lean on too. Um, and when you're in a mental health space where you're taking on, of course, the joys that people are going through, but also a lot of the hardships and the sadness and like the heavy things, you need a community to rely on to kind of decompress, process things, and just have fun. Honestly, I think life is a lot about this balance, and having a community that helps you balance out and have some fun is really important.
Mm-hmm. All righty.